Bienvenidos.
Welcome. Welcome, everyone. Welcome to this press conference celebrating the 10th anniversary of technological innovation in our dear Children's Hospital, the Hospital of Oncology. 10 years where we've given all of our love and all of the science at service of life. We've put it at the service of life to benefit with the best care and the best human quality hundreds of children with cancer. I am Rosana Corona, and I'm a Joint General Director of Teletón Foundation, and I am very excited since today we have with us Gustav Salford, President and CEO of Elekta, Fernando Landeros, President of Fundación Teletón, Dr. Lourdes Vega, General Director of the Teletón Children's Hospital of Oncology. Big round of applause. She brought her own team, cheering team, I know. Dr. Beatriz Eleazar Garcia, Director of Imaging, Nuclear Medicine and Radiotherapy Department at the ITO Center. And our dear Raúl Ocampo, Executive Director and General Manager of Elekta, Mexico and Central America. Thank you all for joining us today. We also like to dearly thank all of the media that once again join us today. And for these 27 years, they've been our main and great allies to disseminate our cause. Welcome, all of you. Teletón is forever your home. We would also like to thank health specialists that dedicate all of their lives with passion to the care of people with cancer. Today we have very dear friends among us, and I would like to thank everyone joining us from YouTube. Thank you so much for joining us as well. Well, today we will announce a very special news that has happened thanks to the summation of many efforts. First of all, thanks to the generosity of Elekta in favor of Fundación Teletón and the families that we care for, we are greatly honored to be able to have Elekta's support, the largest company around the world dedicated to radiotherapy oncology. Now, for us, it is an honor to introduce a leader, a visionary, an amazing human being, a very endeared one, a tirelessly defender of people with disability and with cancer of children that motivates us every day, those of us that are part of Fundación Teletón. He has inspired a full country, and he inspires us every day to work in favor of health of children in Mexico. So let's give a warm welcome to our president, Fernando Landeros. Thank you, Rose, for your kind words, for your kind introduction. I would like to thank once again everyone for joining us today and everyone joining us remotely from their homes or offices via YouTube broadcasting. Definitely, the word cancer moves us all, moves our hearts. Cancer has been called in 1,000 ways, and maybe the word or the right adjective is not found yet to describe what cancer is. For example, the most recent book that I read is The Emperor, and this is a horrible title, The Emperor of All of the Diseases and Evils. We all know cancer because of its effects. Okay, so let's do an exercise here. Could you raise your hands right now? Those of you that have suffered from cancer or that have had any family members that have suffered from cancer. Could you please turn around and see the room? I think there's only 3 hands that aren't raised. So it's that big, it's that huge. Despite the billions of dollars invested in research and treatment, cancer is still there and overwhelming us. How many decades ago we've heard promises, dreams, utopias, that the cure of cancer has been found, but actually it hasn't been yet. In Mexico, for example, every 4 hours a child dies, a boy or a girl with cancer dies every 4 hours. So this means that since Gustav arrived to the Crete, and we've been here for a couple of hours, probably while he lives, a child would have died, a boy or a girl would have died. It is estimated that in Mexico, only 50% of children with cancer survive. Fortunately, at El Hito, the statistic is way better. Cancer is the second cause of death. So today we can say, and you know what, this statistic clearly today has proven not to be as accurate. So today 1 out of 5 people will develop cancer throughout their lives. So around the world, we've calculated that each year there are 19.9 million of new cases of new cancers, with around 10 million deaths due to this disease. So listen to this. Listen to this. It is expected that the burden of cancer will increase in 60% in the next 20 years, which will have a significant impact in the health systems, people, and communities. And the transcending element here is that cancer is not about numbers. Any of these statistics could be your loved one, your father, your mother, or even your son or your daughter. This is why it is of utmost importance to see what's happening today here. And I am filled of joy because today, right here, right now, we celebrate 10 years of the Teletón Children's Hospital of Oncology. Means 10 years of saving lives. This is the only comprehensive children's hospital that's equipped to address this, and with specialty and professionalism, children, boys and girls with cancer in all of Mexico. I still remember very excited how it was a beginning. The beginning, due to the slides, due to floodings in Tabasco, made us build a small oncological unit in that state. And I remember Miranda's mother, a girl with Down syndrome and with cancer, that she would pick her up, and from behind the auditorium she would say, "Mr. Landeros, Miranda is also a girl with cancer, a girl that had cancer, and she was also a Teletón girl. A girl with Down syndrome, she was also a Teletón girl." And so that touched us very deeply. Today we celebrate these 10 years with the conviction that we will continue gathering efforts in order to provide early detection methods and timely treatment, because cancer still demands to put all of our hearts to fight together against it. So I said before, I've survived 2 different cancers, and I know that the fear of death is terrible. However, living some of the consequences of cancer is many times as terrible as death. I remember the 35 radiations that I received, but above all, I still remember today its effects. Cancer and its consequences are a bomb that detonates within the family and core and the closest circles of friends, causing damage. Today, El Hito, that hospital that has been built by many Mexican hands, is definitely, and I say this acknowledging with all of my deepest appreciation, millions of Mexicans. This is the best place in Mexico, in our Mexico, so that boys and girls can win the battle to cancer. The index of survival, it cannot lie. We have the highest survival rate throughout the territory, throughout the national territory. Now, reducing number of treatment to reduce adverse effects is only possible with the best technology. And this is what we, dear Gustav, are celebrating thanks to Elekta. Now, as a reason of pride, we can affirm that we are at the same level as the best hospitals around the world. Today, the Teletón Children's Hospital of Oncology, hand in hand with Elekta, positions itself once again as the Mexican hospital with the highest innovation and technology. Since today it is a reality that we have the best equipment in radiotherapy. Today, we celebrate that we will continue putting love and science at the service of life. Muchísimas gracias, Fernando. Muchísimas gracias. Thank you so much, Fernando, for reminding us the reasons why we are here, and for your amazing passion. You always inspire us. Today, I'm also very pleased to announce that Dr. Lourdes Vega will be providing a very important news besides sharing some of El Hito's numbers. Dr. Lourdes Vega is a renowned person in the field of medicine with an education that includes a specialization in medical pediatrics and pediatric oncology, as well as a master's in management and a certification in bioethics. Her leadership has been evidenced in roles such as former president of the Mexican group Oncohematology in the pediatrics wing and director of certification testing at the Mexican Council of Oncology. As an author and co-author of many papers, her contribution to the medical field is invaluable. In a role as a general director of our hospital, Dr. Vega always shows an unbreakable commitment with the best medical care, with quality care for boys and girls with cancers and their families. Her leadership is an example for all of us, so we hugely thank her dedication in pro of health and the well-being of boys and girls with cancer. Doctor, please go ahead. Thank you so much. Thank you so much for this great opportunity. And I will like to deeply thank you for being with us today, for joining us. You are all special guests of honor. Thank you for allowing us to share with you the joy of celebrating the 10th anniversary of having started operations at the Teletón Children's Hospital of Oncology. We want to tell you that the flag of innovation and technology have always been kept alive here, and 10 years later it is still a challenge, as you can imagine. However, we are moved by the background, by the numbers, where 6 children die every day due to cancer. And statistics, official statistics, were in 2010 we had as a survival rate 60% nationally, 60% of survival rate, and where 7 years later our numbers, instead of improving, went even lower, which means lost lives, smiles that have been lost. 57% of national average survival rate in 2017. There are institutions, I'm sure, where results are quite different, such as the Childhood Hospital in Mexico, but this is a national reality, and we are moved and we are concerned. That's why we wanted to have an incentive to work for children every day. So Teletón's proposal is one summed up in a motto that says love and science at the service of life. And it is one strategy that has 2 components: a comprehensive medical model that covers needs, even if they're social and economic, and there's also a hospital with a home, an in-home, full of the necessary equipment. In this building, you can see all of the hospital, and in the orange building, there's the home where our patients live throughout the time that they will be receiving treatment. Now, I would like to share with you the faces of the first 5 patients that we received 10 years ago at the hospital. All of them are alive today. They are all back at home today, and this motivates us to continue moving forward and to want to open up this model to more patients. In the diagnostic access of childhood cancer, we implemented everything at hand in order to have a full modern diagnosis for children that were treated at El Hito. But the alliance, the collaboration, the welcome that we've had in the oncological pediatric community has allowed us that through collaborations and partnerships, such as the ones that you see here, Hospital St. Jude, the Grupo México in alliance with St. Jude, La Casa de la Amistad, many foundations and hospitals, institutes that have made it possible for this to be opened. and that many patients that receive treatment in faraway places, in Querétaro Hospital, for example, can also have a full diagnosis for a complete, thorough treatment against cancer. We've had a great welcome, and just to show it to you, we can say that in nuclear medicine, growth has been even 40%. The hospital opened with a PET-CT equipment that was the first one in the state of Querétaro, and today this is an equipment that provides care to children and to adults that need this service, because there is a huge need in society of diagnosis and quality treatment against cancer. The guiding principles of oncological treatment demands us to do it timely and thoroughly. Chemotherapy, radiotherapy, surgeries, high specialty surgeries, high complexity specialties, marrow transplants, immunotherapy, precision medicine. All of this is being addressed, and we are also tackling the causes of complications that endanger the life of the patient. Support management, the reduction of complications, such as this little one that received a laser treatment in his mouth in order to reduce, and it did quite reduce, the risk of presenting ulceration as a product of chemotherapy or radiotherapy. This was even a research work that received an award because the results were extraordinary, amazing. Now, the guiding principle of quality of life, the support, the observation, where we provide support to the family members. Where the cradle of your home is, that's where your home is. So what we do is to give the family members a place where they can live as long as they need, so that they don't have to leave treatment for any situation, economic, social, any. Casa Teletón is a place that saves lives, that was offered as a part of the hospital with a medical goal to improve treatment adherence and compliance, and to reduce the index of treatment withdrawal that brings to the death of patients because they just suspend any treatment. We have a home at the reach of our children so that they can live there, they can go to school, they can go to workshops, and they have a 24/7 place for any emergent situation. The most frequent cancer is the acute lymphoblastic leukemia in children. So to sum up, I would like to share some results. We propose to lower the death rate in the induction stage, which is the first part of the treatment. We know that in our countries around 10 or 12% of the death rate. So we wanted to keep the rate in the international standard, which is below 5%. We achieved that, and today we can very proudly say that the last kid that died in the induction stage was 6 years ago. Since then, there hasn't been any death in the induction stage in children that have come to Elekta. 97.5% of patients go to remission, and the survival rate in patients of acute lymphoblastic leukemia of standard risk is 91% at 8 years, and in high-risk patients, to 78%. We have carried out 142 bone marrow transplants with 99% graft, and we have the only blood bank, 100% humanistic. We don't ask for any replacement blood. We work in campaigns to obtain that blood that has been used, and we work in precision medicine. We have 56,000 dosage of chemotherapy with a rate of infection, intra-hospital infection of 2.6 in the international standard, more than 2,000 surgeries, with a survival rate in the ICU of 95%. That also allows children to continue receiving the treatment and for them not to die in complication stages. Now, it is I'm full of pride in telling you that more than 700 children around the country had access to a complete and accurate diagnostics of acute lymphoblastic leukemia without having to go to El Hito Center, because with these collaborations we receive their samples so children can have a better treatment wherever they are. We have started having this activity at an international level to provide training. We receive health professionals and physicians from many countries around the world, from Latin America, from Spain, that come and work in the surgical department with us, which also fills us with pride. We bet for young people to bear in mind that children get sick of cancer, and with this college alliance, a partnership, we work with many institutions on the timely detection of childhood cancer. Once again, in Mexico, 6 children die a day due to cancer. And in this same line of thought, talking about survival, we can add the survival of Teletón's hospital, where we have 82.6% of a global survival, overall survival rate. We also want to share with joy a news that will change the care provided to children with cancer that need radiotherapy. This event, in the framework of the 10th anniversary, is also because Teletón Foundation, along with Elekta, have made reality to be able to have a linear accelerator with a very novel technology, a Unity accelerator, an Elekta Unity accelerator, which is an accelerator resonance. We are going to hear details about this equipment and what we've done radiotherapy-wise, and I would like to use my last minute to talk from the corner of my heart as a pediatrician and oncologist. When we say we are oncologists and pediatricians, they're like, and how can you? I mean, how can you? Well, we can because we feel identified with the pain, with the suffering of children. We can because being able to join that battle legitimizes us. We admire them. We admire their families, their fight. That's why we know that cancer that causes so much damages at a family level has to be addressed comprehensively for everyone, every member of the family. As pediatric oncologists, many times we knock on doors, but they don't not open. Many times we knock, many times we kick the doors even because they won't open. So what I want to say you with this, what I want to tell all of you, my colleagues, mainly colleagues, you are like my brothers. Teletón will open the door for you. And we are looking, and we've learned in these 10 years how we can make or manage a virtuous system where, economically speaking, sustainably speaking, we can offer access to more people, more children with cancer, so this door remains permanently open. We will make it because we've worked together, because we are still collaborating, and because many children are expected from everywhere around the country. So for them, everything is worthwhile, the effort, the work, and the support that Fundación Teletón has given us for so many years. Thank you very much. Now, Dr. Beatriz Garcia Robles, Subdirector of Radiotherapy, Imaging, Nuclear Medicine Department at Hospital Teletón, will tell us a little bit more about what we've been doing at the Radiotherapy Department and what this new equipment represents to us, what it means to us. Thank you so much. Thank you. Thank you so much. So I would like to start my participation by thanking you, by thanking Mr. Landeros, by thanking Rosana Corona, by thanking Dr. Vega for the opportunity that you've always given me since 2016, promoting, growing, and I can achieve more and more in radiation with children. I would also like to thank the amazing team at Elekta, and I think I'm going to be part of your assets now because I've known you for more than 20 years, since I was a resident at the medical center, Siglo XXI, and I will be also telling you about the amazing commitment that they have with our children. And especially, I would really like to thank the society in general. I would like to thank everyone and anyone donating, any adult, children, families, our families that every year donate, because this is exactly what makes possible what we all do. So I want to tell you that the radiotherapy services are quite scarce in our country in such a way there's less than 300 accelerators in Mexico, while because of the population that we have, we would expect to have double or triple that number. We have 457 certified oncologists by the Council of Radiotherapy, out of which we are only 20 of us that are pediatric radiologists. And I want to thank Dr. Federico, President of the Mexican Society of Radiotherapy, that today is joining us. He's been my teacher, my professor for many, many generations. Thank you so much, Doctor. Now, radiation will be necessary at some point of the children's oncological treatment, up to 30%. Why so little? Well, because the adverse effects are so important, the effects are so there that will cause maybe an alteration in learning abilities. So we are focusing more and more in having a precision medicine, a less toxic one. In the case of adults, 60% of patients at some point in their lives will require some sort of treatment with radiation, whether it's a radical one or as a palliative care purpose. At Teletón, at the Hospital Teletón, we have opened our doors to adult patients on our program that's called Teletón Vale por Dos. Every services that we provide to adult patients will fund, in turn, a similar one in a pediatric patient of low income. I see patients from Tijuana to Chetumal throughout the countries through foundations that allow for these children not to increase the waiting lists or not to get lost in these waiting lists at hospitals that have radiotherapy services so that they can receive in our hospital a timely, safe treatment, especially under this comprehensive care and support of Teletón. So this picture is the time when I came to Teletón Hospital many years ago, as you can see. This was my initial team, a physician, 2 technicians. This girl that came from Guerrero, Acapulco, she trusted us, and she's still alive. She's now in secondary school. Unfortunately, this was only a bad dream for her now. Up to December 31st, 2023, we've treated 1,540 patients between adults and children, out of which we have techniques that go from the simple one, which is 3D, radiosurgery, modulated intensity in dynamic arc, and this is one of the best and first kids that participated in the transplant project. He's also alive, and he's also fulfilling his school dreams. Technologically speaking, we have only one Elekta equipment. Initially, it is a Synergy. In order to be as precise and as effective, we have verification and dosimetry systems, as well as a team of engineers, on-site engineers, that always provide support when any of these systems fail. Because it is not only talking about services or acquiring an equipment. We need also maintenance. We need someone that can provide support so we can use it and have it readily available. In 2017, our transplant program was open. As Dr. Vega said, we've had 142 transplants done with a survival rate of 98% to the 100. This is amazing. This makes us one of the transplant units, one of the most successful transplant units of the country. Now, of these 148, we have offered to 95 patients total body irradiation, the TBI, pre-transplantation. And this is one of the hospitals that has this technique, because very few of them have them. We're like 3 tops, and we have a great numbers with low toxicity. In 2020, we had an update of our hardware and software, and we see this child dressed up as an astronaut, because we have a psycho-behavioral program where I was telling you this morning that I am an astronaut recruiter. I send them to space in their spaceship, and we are always promoting for this experience for children to be the most pleasurable as it can be, right? So our child will start a trip to a star for 5 minutes every day until they complete their treatment protocol. We actively participate with different radiological safety projects and in international training, along with the IAEA, the Atomic Studies International Agency, a branch of the UN. And I would like to say hello to Dr. Enrique Estrada, joining us from Vienna, from Wien. He is a representative of the Health Services Department at the IAEA, and today we have a cooperation and partnership center with them in order to provide technical training for all of Latin America. So we do all of this process. Our children, we need for them to have a positive behavioral reinforcement. So we do anything that's necessary so that those patients less than 5 years old do not move, so that we avoid laceration and injury. So we have 6 children that are younger than 5 years without sedation. We don't have to apply an anesthesia to them to be able to radiate them. So the younger child has been a 2-year-old, which is amazing.
So I deeply thank all the engineers in Elekta that are here today, because every day they do a donation of toys. So every day the children finish their radiation, they get a sticker and they put it on their record, and we can see that this patient filled in all the map and it got its acknowledgement before finishing, after finishing treatment. So this allows us to keep fulfilling dreams. Currently, our project, and the one that I'm very thankful for, together with the Elekta Foundation, is the one where we have a program with canines. So these are making our days, not only when they arrive, because, well, we have the pets there and also the collaborators. So we hug our canine colleague because they help us and they make us feel better every day. So this project is implemented and it is under the infection control protocols and safety for our patients. This is our new equipment, and thanks to everything that we have achieved, thanks to all of you. And now I would like to announce and repeat that we will start this project of Elekta Unity, and I hope that we can start operations on March to April 2025. So this is an accelerator that is fusing energy, and it allows treatment to be even more accurate, because every day it takes an image and it adapts much better to the changes that the tumor has with the radiotherapy. So it allows us to have 1/3 of the sessions that were currently scheduled. So you could have received at least 8 instead of the 35 sessions in this case. So it's going to be available for all of our patients, especially for children in this country. So it is really a technological innovation, and we are glad to be able to create these cooperation links with all of you. And I would like to introduce my team. So let's create this link directly to the radiotherapy department in the Teletón Children's Hospital of Oncology in Querétaro. Let me introduce the Directive Board, Gabriela Escamilla, our medical director. You have the floor, doctor. Hello, and we are in radiotherapy, and we are very glad to receive this news, because we will now receive a new linear accelerator from Elekta. For 10 years, we have taken care of our patients. This equipment will allow us to provide high-precision treatment to avoid effects and secondary effects of the patients. With this technology, we are increasing the survival rate of our boys, girls, and teenagers, and all the young population of our country. Thank you so much. Thanks to the Fundación Teletón, and especially thanks to Elekta, because they are giving us the opportunity to have success stories in each one of the people that we are having an impact on, so that we can make their lives better and they can follow their own dreams. Thank you. Thank you so much, doctor, and thanks to all of you, because you are working together with us, with the physicians, with the technicians, with the nurses, with the patients, with the parents of the patients. Thank you so much for that. Thank Thank you so much, Dr. Betty, and thanks to all the team of Fundación Teletón and the Teletón Hospital. It's amazing to see how in 10 years we have been able to witness all these achievements. Thanks to the donations of the society, we have been able to give service to hundreds of boys and girls in our pediatric model. You can see the results of Dr. Lourdes, so thanks to the society for that. And one of the things that we're very proud of in Fundación Teletón is that we have been able to join generosity of many very important stakeholders like the civil society, the government of the state of Querétaro, who is supporting us with a contribution every year, and with our dear allied institutions such as Fundación Díaz Morado. Thank you, Manuel, for joining us today. Dear institutions such as Elekta, because these are two main institutions, Díaz Morado and Elekta, the ones who had made this possible to celebrate the 10 years of carrying hope to the families and the homes of many states around the country. So I would like to communicate that Fundación Díaz Morado created and gave a significant contribution to the equipment of the Teletón Foundation in this 10 years anniversary to be able to acquire this linear accelerator, Elekta Unity. So the company Elekta also offered very special conditions, very special conditions to be able to get these highly technological device. So we are immensely thankful with Fundación Díaz Morado and with Elekta for making this dream possible and for taking the technologies to these hospitals. And we are very honored to announce this in the context of the visit of the Kings of Sweden. Nothing better than joining nations to fight against cancer and to keep dreaming together. And as I mentioned at the beginning, we have Gustav Salford, President and CEO of Elekta. Gustav is a leader with a great vision for international affairs and international business, and with a deep knowledge of medical devices. He has been in different positions before he became President and CEO of Elekta. But before Gustav shares some messages, I would like to share a video that shows some of the campaigns that have been part of the achievements of Elekta in the life and the treatment of cancer in children in Teletón. Let's watch this video.
Esta es una máquina para cumplir sueños. Fue construida con mucho amor. Desde que llegó al Hospital Teletón, ha devuelto la sonrisa a Samantha y a cientos de niños y niñas más. Porque en Elekta, lo que más nos gusta es cumplir sueños. Elekta y Teletón. ¿A ti qué te gusta hacer para apoyar a los niños de Teletón? En Elekta nos mueven sus deseos. Elekta, Teletón, nos mueves tú. 5 de diciembre.
Mi hija quiere ser astronauta. Cada vez que se sube al acelerador lineal de Elekta en el Hospital Teletón, no solo curan su cáncer, también la acercan a su sueño. Seguiremos luchando porque somos tercos y porque tenemos a Elekta y Teletón que son como nosotros. Elekta y Teletón, contigo no hay imposibles. 4 de diciembre.
En este cumpleaños deseo que más niños como yo puedan curarse del cáncer en el Hospital Infantil Teletón de Oncología.
En este 25 aniversario de Teletón, haz sus deseos realidad. Elekta se une a los 25 años de Teletón, apoyando a niños en su lucha contra el cáncer. Elekta y Teletón, 17 de diciembre.
En el Hospital Infantil Teletón de Oncología, la lucha contra el cáncer cobra vida en cada radioterapia. Ahí, poderosos rayos y corazones combaten a las células cancerosas que invaden el cuerpo de muchos niños y niñas. Juntos estamos ganando la batalla contra el cáncer. Elekta y Teletón laten en el corazón de todos los mexicanos.
Para cada evento. Gustav.
So, Gustav?
Thank you so much. What a beautiful
Muchas
video
gracias.
and
Qué
such
video
an
tan más
inspiring
hermoso y
event.
tan
My Spanish is not perfect yet. I will exercise it, but for the next time I come, so I'll do this in English. But it's such an honor to be here, to see your vision come alive, both in rehabilitation but also in cancer care for children in Mexico. It's absolutely inspirational and something that I will remember my whole life. So big thank you for that, your vision coming true. And just being a small part of that for myself and for everybody here from Elekta, that's a global company for 120 countries, is truly, truly fantastic. So I just wanted to say a couple of words about what Elekta do and our partnership as well. And it's really a great pleasure and honor to be here for the celebration also of the 10th anniversary of the Children's Teletón Oncology Hospital. And on this milestone, I want to extend my heartfelt congratulations to every one of you. Such a journey you're showing with a spaceship. Fantastic. And we are a very, very proud partner of your outstanding Children's Oncology Center. And this is one of the most advanced in the world. And I've seen many cancer centers, I can assure you. But your deep, deep dedication to providing medical care, rehabilitation, and support services to children with disabilities had made immeasurable impact in their lives. And through your tireless, truly tireless efforts, you have not only transformed individual lives, but you have also inspired communities and created a truly spirit of compassion, humanity, and solidarity. And your commitment to excellence and your passion for making a difference continues to inspire us all. And this week is a special week for Sweden as well, because the Swedish king is here in Mexico on a state visit to strengthen the ties between Sweden and Mexico. And we are here, many Swedish companies and different foundations and institutions and universities, to continue to build partnerships with other institutions throughout Mexico. And I'm very happy to be right here today because I feel so honored and committed to this long-term strategic partnership we had with Teletón. For us, it represents an incredible opportunity to work together towards the same goal, and that is improving the quality of life for patients through innovative solutions in radiotherapy or neurosurgery, and thereby contributing to the fight against cancer and other serious illnesses. And at Elekta, we are guided by our purpose, and that's of providing hope. And I've seen so much hope here today across all the people I met. It's for everyone dealing with cancer. And this is, of course, especially true for children and their families. Don't forget the families that should receive the best cancer care independent of where they live, with the highest level of precision and what we call personalization. So therefore, I'm, of course, very, very happy to soon deliver the most advanced radiotherapy in the world. And that is MR-Linac accelerators, the Unity, the new spaceship to the children. And now it's really about allowing you, the doctors, the clinicians, to see the cancer in real time when it's moving. And then you can be much more precise in how you can treat that cancer. And then you can reduce the time it takes from up to 6 to 8 weeks down to maybe a week. And from maybe 35 fractions down to 5 or even 2. And you can just imagine the benefit for the children, the families, the doctors, the hospitals, and also the society. We are so grateful and proud of being part of this journey, this space journey. And cancer care is, I think, a team sport, and you showed that in real life as well. It's when we work together, industry, clinicians, academia, universities, foundations, that we can bring true innovation to the patients. And nothing could be more important than your mission. And we look forward to work alongside you, together with the clinicians and researchers all over the world, because this is a global pandemic, to enhance the new ways of treating cancer and provide hope for the children and their families who you are so dedicated to serve. So I would like to end with giving you my best wishes for another decade and many decades of continued success, innovation, and impact for humanity. And together, let's strive to create a brighter and more inclusive future for all. Big thank you. Thank you. Thank you so much. Thank you. Thank you. Thank you. It's been a pleasure. Thank you.
Gracias, Gustav. Thank you.
Thank you so much, Gustav. On behalf of all the Teletón Foundation and on behalf of all the patients that are treated in the Hospital Teletón, we thank you. Thank Raul. Thanks, Gustav. This is your home. So thanks, everyone, for joining us today. And, well, only if we take efforts together, we're going to see success. Thank you, society. Thank you, Diez Morado. Thanks, media. Thanks for your commitment for being here today. And thanks to all the people who are watching us through YouTube. So we're going to open the session for a Q&A. I would like to know what is the percentage of patients that have been treated in Querétaro? I mean, what is the percentage of children out of these 1,500 patients in Querétaro? And how much does it cost? Is it free of cost or is it some kind of recovery rate? And number 3, how costly is this new spaceship? Because sometimes it can be difficult to imagine this. But when the doctor says that in Mexico there are very few equipments, that we need 2 or 3 times more, how do you solve the situation? Well, these are the 3 main questions that I have because I have so many questions to ask. Well, out of the 1,500 patients in Querétaro, almost 50% are children. This Teletón Vale por Dos project is funding children of low resources, and we have identified the states where we can have more patients. The first one is Querétaro, the second is Guanajuato, and from there we have Quintana Roo, which is the third one, and we have states where the health systems have some delays. We've received patients from Tamaulipas. In Tamaulipas, there is just one linear accelerator in the entire state, and they treat mainly children. And well, this works very few times in a month, and they have a very long list to treat these patients. And I have received different states, Chiapas, Oaxaca, Guerrero. These are low-income states, and now the hospital and the Ministry of Health had a lot of damage due to the Otis hurricane, and we are receiving all the children that were treated there and free of cost, and both for chemotherapy and radiation therapy. So if a treatment is very costly, then since we are a foundation, we are non-profit organizations, so, well, it is much more accessible for adults, and at the same time, it allows us to help low resources children. Yeah, we receive the support from different foundations, such as Casa de la Amistad, Fundación Vuela, local types of institutions that can make reference to children that are in Querétaro. So they go directly to Casa Teletón because, well, they can stay at least for 5 to 8 weeks. And that cost of stay, meals, and transportation services is absorbed by other institutions and even by ourselves. Yeah, I would like to talk about these patients because most of them come due to some alliances or partnerships that we have with different institutions, and they are fully covered through these institutions. And we have hospitals, sometimes we have government and private hospitals, and we have partnerships with other insurances and the support of other institutions for these children where they don't have an access to treatment. So time is very important in this case. The treatment scheme where a child, for example, needs to receive treatment before he or she is received surgery in the first 10 days, if it's not done that way, well, it can be causing some effects. So we try to do it within those days after their surgery. So we do a social and economical assessment so that we can make it affordable for the families to receive those services. So it means that the cost for the patient is around 1% of the real cost of the healthcare service. There are many children who are suffering complex situations, and they've had a service of over 14 million pesos, but money is never a limitation so that they can receive service. We're always moving ahead. We're always supporting the needs of the children in medical terms, and we always expect it to do in the future. This is high technology devices, and well, they are very costly, and we want to put it at the disposal of the population. So this has always been a part of our institution, of our Fundación Teletón. I came here and I saw that it was very clear to see the benefit of these patients. We are a non-profit organization, and we get allies and partnerships like Fundación Díaz Morodos so that children can move ahead and they don't withdraw their treatments. Any other questions? Hello, my name is Eduardo González from Grupo ASIR. Good afternoon. I would like to ask you if this accelerator is going to... I understood that there's going to be less sessions of radiotherapy for children, so this means that more children will receive treatment, right? So maybe that will reduce the waiting list. I don't know what's the waiting list that you have in El Hito to be able to treat patients. I remember that when El Hito was built in Querétaro, you mentioned that there's a low level of pediatric oncologists. Apparently, it hasn't increased much. So how can you invite these physicians to be part of this specialty? Well, in terms of the number of sessions, of course, this for us is very important to be able to offer the technology to all the children in our country. We don't have a waiting list. The waiting lists, unfortunately, are in the public institutions. We know that they have been delayed for over 6 months. And in the best case scenario, it's just 1 month in the waiting list. And when I see that they say, oh, this is a child and he or she should come receive treatment earlier, yes, but we have a mother of 2 children or we have a grandfather. So in an oncological department, they are all patients and they're all important. So if we have a specialized hospital to children, then this idea is to have a space for these children with the appropriate treatment. And I forgot to say that, yes, there are very few accelerators, and I'm very sure that the country has the right resources to be able to get more equipment. Unfortunately, cancer did not have a national program recognized by the Senate or by other institutions. We saw that not long ago. So now we are widening these proposals for healthcare access in oncological patients. And all the children can receive their radiotherapy with us and then go back to their units to continue their treatment. And I would like to say something. I would like to mention, because Gustav asked me a few moments ago, how difficult was it to recruit and to gather all the team from the hospital. And I said, it's very easy. There are very few. I said, it is very easy. And the answer is, because I remember that Dr. Andrea said, nobody wants to do this because children are dying. That is the answer of the doctor. Nobody wants to do this for a living where the diagnostic is so negative. We all already saw that in the figures. So when we had these doctors 10 years ago, I think it was 100 pediatric oncologists around the entire country, and they realized we wanted to put everything together, and they raised their hands and they said, if we're going to save lives with these tools, yes, I can save lives too. So this is a mixture of many things. It's incentivizing more people so that they're specialized in pediatric oncology. We also need to give them the right tools so that they can apply their love and their science. That's the only way we can recruit them, because otherwise it's like driving a Formula One without a wheel drive, right? We're not going anywhere. So I remember some meetings, internal meetings that we had to get to an agreement, and I thank Manuel from Foundation Diaz Morodo, because this is one of the reasons we decided to take a step forward, because, well, this is a very costly equipment, but this allows us to motivate more young people who are dedicated to medicine, to oncology. They're starting with their pediatric oncologists and the radiologists, so that they can say, we can actually save lives with this. We can reduce the secondary effects, and these children can live their lives. So in that sense, I think this news, it's the tip of the spear, so that many doctors are encouraged to save lives because they have the right tools to do it. Fernanda Garcia from Heraldo de México. I would like to ask you, in which countries do we already have this equipment, the Unity equipment, and what have been the results in these countries? And if the oncologists that need this, I mean, the oncologists that are going to be using this equipment need some kind of specialization or training besides from what they already have, or do they need to study to I don't know if you understand the question. Yes, and the countries and results. Bueno, voy a comenzar mi respuesta. Si entendí
Globally, where we
correctamente,
have MR Linux and Unities. And it's a very global technology because it's a paradigm shift. We're doing something new that was not possible before. So we're able to treat cancer cases that you couldn't treat with a regular radiotherapy equipment. So we have a lot of them in Europe, in Sweden, in the Netherlands, in the UK. It's often the leading cancer clinics. In the US, it's MD Anderson or Johns Hopkins and MSK. And in China and India. So it's a totally global installed base. And then they collaborate a lot together. It's a truly partnership because they learn. So here will be a great opportunity to learn here in Mexico from some of the leading cancer centers in the world. And we have a consortia of the doctors that will come together and talk about new treatments. So that's one way to learn. And then to connect the doctors. And then we learn how the machine works and so on. So it's a truly global trend. Adaptive radiotherapy and MR Linac radiotherapy that I think is so fantastic that you can give to the people in most need. It's children with cancer.
¿Y cuántos equipos hay aquí en México?
Raúl.
¿Cuántos equipos hay en México?
De este desayuno.
En México, de estas características, me atrevería a decir que con la configuración y con este
With the setup and with this purpose, we have only one. And there is an implementation in the north part of the country, and we will get around our third equipment. But this is the first one with these characteristics and with this purpose, with this combination of technologies in favor of children. And And in terms of training, what I would like to say is that from the 450 radiologists that we will have to treat patients with cancer and radiology, we only have 20 radiologists that work with children. From the pediatric oncologists, we have more. I think the doctor will have the proper numbers. But in terms of training, we always work together with Elekta, and we need training courses in terms of the technology. In terms of cancer, we have biological behaviors that we have been studying as oncologists, and that doesn't change. What can change is the adaptation of technology to the proper treatment. And in pediatric oncologists, when the hospital opened, it was a very reduced number, around 130 pediatric oncologists. And in these 10 years, we have been seeing an increase. We have seen other places being open, like El Hito, and we are training pediatric oncologists. And the current number is 355 pediatric oncologists in the country, plus the ones that will be joining us after the exam. 11 of them applied, so let's see, but this is the current number that we have. Our apology, we cannot listen to the question without a microphone on the booth. These are pediatric oncologists. They are trained, they finished the specialization, but there is a certification from the Mexican Oncology Council, and they have to pass an exam. It's a very difficult exam, yes, it is very difficult. But let's see. We don't have results yet, but we had 11 people postulating to that position. There's a young girl who wants to ask a question, and I think there was another question over there. Okay, who should we give the microphone to? Hello, Edgar Estrada from Grupo Radio Centro, Joya 93.7, Hoy con Mariano, and you are working every day, you are working all day long to make this possible, just like Mariano. So this is great, but what can the society do all year long and not wait until December to do a contribution? Yeah, that's a great question. Thank you so much. Thanks for being here today. Because you're talking about someone who is very important in the foundation, is Mariano Osorio. He is a communicator and a person that has been committed not just one day to Teletón, but 365 days. And there's a program that is paramount for us, which is called Padrinos, like godparents. So this is for the people who don't think it's enough to just contribute with money just one day a year. They want to contribute one day a month. And this member, the founder of this program, is Mariano Osorio, together with Claudia Lizalde. So this program has been there for some years now, and it might not seem as important because maybe you think, oh, it's not enough to give 300 pesos a month. But now, thanks to this program in Teletón, and well, this is the answer to your question of what can we do every day, is that we're generating $1 million a year in 200 or 300 pesos a month, thanks to Padrinos Teletón. If you are watching us today and you say, that's great, from Elekta, from Fundación Díaz Morodo, and thanks to the doctors, but I also want to be a nice person and I want to contribute because it's not enough for me to contribute just one day a year, please enter to the Teletón webpage and become padrinos, become godparents of these children, because it makes a huge difference. How many children are there in every crit? Well, thank you. That's a very good question. We could say that in 80% of these centers, they treat around 1,000 children. But there are larger crits like this one, where we have 2,500 children. There are others, like in the state of Guadalajara, we have around 2,400 children, and thanks to new programs implemented by the federal government now, I would say that in closed numbers, we are treating 35,000 children every day. 35,000 children. As Mexicans, we have built the private children's rehabilitation system that is the largest in the world. You know why? Because the heart of this country is also the largest in the world. Well, there are no further questions, so thank you so much for joining us today, this morning. Have a great week.